Welcome to Spotlight. I'm your host, Jane Wernette. Today I'm joined in studio by two local nonprofits, the Kisat Diabetes Organization and Martin Avenue Apartments. But first, we head on location to the Naperville Area Humane Society.
Today's Spotlight is brought to you in part by presenting sponsor, UC Bank.
So Christine, thank you so much for having us out at the Naperville Area Humane Society. We really appreciate it. We're in this sort of free dog roam space, but before we kind of talk a little bit about that, let's talk a little bit about your mission.
Yeah, well, Jane, I just want to say thank you so much for being here with us today and coming to explore our space. So we're with the Naperville Area Humane Society, and we specialize in dog and cat adoptions, providing as many homes as we can for cats and dogs and finding them loving and good homes.
So we're in this, it's really a cool space. So
Yes.
Explain what you do with the dogs here.
Yeah, so this is one of two of our dog play space areas, also known as a dog run, so you might hear that term thrown around here as well. So this space is really fun and really great, really essential for our dogs because it really lets them stimulates their minds, gives them exercise, which is really essential. They get to socialize in this space. We do have dog trainers on site that work with the animals and the dogs every single day. They utilize this space quite often to get to know their personalities a lot more and just how we can help them before they go out for adoption.
In terms of the dogs, are you've got like a smell or scent garden? Or
We
hey,
do,
what is that?
yeah, so it's kind of fun, right? So our scent garden, sniff garden, whatever you want to call it, again, is another really key enrichment piece for our dogs here. So they get to go into the garden. We have different herbs, different scents. There's dirt where they could dig. There's sticks for them to chew. There's balls, there's tugs. They really get to kind of use all their senses and really, again, decompress in a quiet environment. It's less stressful, be themselves, and really just be a dog, right? 'Cause that's what dogs want to do. That's really important for them, all these senses.
From a standpoint of how many dogs and how many cats, on average, what are you usually housing?
That's a great question. So last year we adopted out 737 dogs and cats total.
That's a lot.
Yeah, it is quite a bit, and we're seeing an uptick, of course, with owner surrenders and whatnot. Where we're very fortunate that not all the animals have to stay at the shelter. They get to actually go home, and that's always essential and great too, because we get to learn more about their actual personalities and what they would be like exactly in a home. So fostering is amazing, and I always like to say, as most shelters would, is that you truly are not just saving the pet that's here at the shelter. You are opening up another space for another animal to come in. So you're really saving two pets. Exactly.
Oh, that's wonderful.
Yeah.
Well, speaking of saving pets, let's take a little walk, and we're going to go check out the cat-free roam area, which I'm super excited about.
Happy to. Thanks,
yeah,
Jane.
absolutely. So Christine, now we're in this cat-free roam area, which is super fun, I have to say. I sort of wish I could jump around on some of these things, but explain why you have this room.
Yeah, so Jane, this is actually one of my favorite spaces, especially for our cats. So like you said, it is our free roam cat space. We have one of two here on site at our shelter. It's a really fun space for cats. All of our cats initially will be evaluated before they come in here just to make sure that they're okay with other cats and their socialization is up to par, with all the others. We don't just throw cats in here. We
no
make
cat fights.
Yeah, no cat fights. We're trying to eliminate all of those as much as possible. But this is a fun space because cats are very sensitive creatures, but also very chaotic creatures at sometimes and playful creatures at sometimes. So you could see behind us, there's kind of almost like a wall maze that leads up. So they're able to really crawl on that, jump on that. This is a scratch post. So there's a lot of different textures in here and elements in here that cats love. We also have a lot of hideout spaces for them.
Okay.
Because like I mentioned, cats are very sensitive and they do like their personal space at times as well. So we want to make sure that they have that, right? So here at the shelter, it's very important that we're creating these very stress-free spaces for our animals as much as possible. Hi, buddy. So that they can come out. We can learn more about these guys. This space is also amazing because our staff, volunteers, and potential adopters that do come in really get to know more of the cats' personalities in this space.
Yeah, I can imagine.
Yeah, exactly. They get to hang out with them. We learn more about the cats on a day-to-day basis and how they might interact more in a home. So this space in general is just a really fun space for our cats. Yeah.
Yeah. Well, and I also like the fact that they're curious animals, and there's so many different things for them to be entertained by, right?
Oh, yes. And we actually have what we call our kitty condos as well. So it's not
Explain more with that.
Absolutely. So it's not a free roaming space like our free roam rooms are, but they do have 2 levels. So that's why we call them kitty condos. They kind of have an upstairs and a downstairs. They have their own little bathroom section, and then they have kind of like a bedroom. Like honestly, they can go in and sleep, again, giving them that space that if they don't want to be out and they want kind of their alone time, we absolutely respect that and we let them be. But I also want to point out that just because those cats are in the condos and not in a free roam space like this, they're getting plenty of interaction time throughout the day. So we have a great community of staff and volunteers that are here every single day that are interacting with our cats. Same with dogs, of course. We actually have a kitten nursery as well.
Okay.
So yeah, so when it's the height of kitten season, which is usually spring to early fall, we get a ton of kittens coming in, or mothers with their kittens coming in. So that space is a lot more quiet for them. They can be put in that space to kind of interact. For kittens, it's very important, right, that they socialize at that very young age so that they're good with other cats and good with their families or whoever. So that's really essential. For being kittens, right, is that socialization skill set. So that space is really great where they kind of have their own space to interact with one another, but also it's a calming environment and it's quieter and so
not
that's
quite ready to get out there in the general
Exactly.
population.
Yeah, not quite ready maybe for the free room with the big guys yet, but one day.
One day. Or they'll go out earlier in an ideal world,
exactly.
right? Christine, this is great. Let's go take a look at the exam room, shall we? Okay.
Perfect.
So Christine, we're now inside the exam room. Talk a little bit about what you use this space for.
Yeah, so the exam room is really an essential space of our shelter. So every single animal that comes in, once they arrive, they'll get an initial overview medical exam in here. We also will do initial vaccinations here. All animals do get spayed and neutered. We just do not do it here at the facility. So we do partner with other local facilities to do the spay and neuters, but they get microchipped. We just make sure that they're healthy before they go up. So this space is really essential for the overall well-being of the animals that come in. So
okay, and then they're ready to be adopted after they've had partners, spay and neuter, and they've had their shots and they've been chipped. Is there any follow-up that happens with that?
Yeah, so after an animal does get adopted from us, we do phone calls, we do regular check-ins with them, just to make sure that everything's still going well, all the animals are doing really well in their new homes, the families are doing well, it's still a good fit. If there is ever a case where one of our animals needs an initial vaccination again, or some blood work, we do actually do that again here at our facility. So sometimes we'll have animals come back to our facility even though they've already been adopted, and we will provide that service to them.
Yeah, well, and I think too for the family just to be able to touch back. That's a nice resource to ask a question, or they know where the animal came from, and you provide that trusted service, right?
Yeah, we absolutely do. And we always love when adopters share photos and stories, and we want to stay in touch with all of them. So we love seeing them at events. We just had a 5K last weekend, and we saw a lot of our alumni there, so we love it,
So I'm sort of a growing family of animals.
That's absolutely correct.
Yeah, love that. Christine, thank you so much for having us out today. We really appreciate it, and for all the good work you're doing for our furry friends.
Thank you so much, Jane, and we love it, and you're always welcome back, so please come visit us.
Today's Spotlight is brought to you in part by presenting sponsor, Busey Bank.
This is the Run My Own Business Dream. This is the college's paid for dream. This is the retire early dream. This is Busey, where your dreams and possibilities become moments through trusted guidance and expertise, through lifelong relationships. Because we're here to help you achieve the life you've always envisioned.
Today's Spotlight is brought to you in part by presenting sponsor, Busey Bank.
Welcome back to Spotlight. And joining me now from the Kisat Diabetes Organization is Dr. Nuzhat Chalisa. So nice to have you on the show.
Thank you so much for having me.
Yes. Now, I'm excited to learn about this because it's a relatively new organization. So start out by telling me a little bit about how you got started and your mission.
Sure. So Kisat Diabetes Organization, we founded in 2017, and that it was founded as a tribute to my father who passed away from complications of diabetes. And I'm so glad that what was a big loss for our family turned and enhanced into a much bigger mission of empowering others and educating them.
Okay. I'm sorry for your loss. And unfortunately, that's a growing situation, right?
Yes.
Yes. So talk a little bit, I mean, obviously that was an impactful moment that sort of started your whole organization.
Yes.
But talk a little bit about what you're doing now and kind of what your approach is.
Sure. So our mission is to create awareness about diabetes, and we do that by offering screening programs for diabetes and diabetes education. And we actually reach out to people. We participate in community events. We have our own programs where we conduct screening and education. We reach out to schools. And the interesting thing is, like, we don't want to restrict ourselves to one age group or a particular people from a particular background. We're open to all cultures and all age groups.
Okay.
And our ultimate goal is to not only to screen people for diabetes and preventing it, but to help them manage the diabetes. Because one thing is preventing it, but the other thing is, if you have it, you can still prevent complications of diabetes.
Okay.
By taking care of yourself.
Okay. And so with those screenings, are those screenings free? And how does that work?
Yes. So we do provide a free screening.
Okay.
So like if we are participating in a community event, we will go, we have a team of professionals who are trained in performing screening. And so we will have our table or a booth there, and we will offer free screenings. And if we find somebody who has diabetes, and if they don't know, or if they have uncontrolled diabetes, then we have we educate them. We have a registered dietitian who works with us. We have medical assistants. I'm always there, so we educate them, and if they want some resources, we offer them resources to take care of themselves.
Okay, so that's really nice. So if finance is maybe a hurdle for somebody to get into, this is an opportunity for them to get that screening.
This is a great opportunity to get yourself at least checked to get started.
Yeah. Well, an ounce of prevention, right?
Sure,
and if you know it early. Talk us about something that kind of excites you for your organization as you're kind of moving forward with this.
Yeah, something that excites me is that, so one of the things that we're doing is obviously involving the entire family. I think that's our mission, because like if we do a walk, we want the whole family to come. Now, not everyone would be able to walk, but we want to include the kids, we want to include the seniors, and a lot of focus on the seniors because that's a growing population.
Sure.
So we want to involve them. We offer different kind of activities for them. And we also participate in a lot of senior fairs, and we reach out to them wherever they are.
Okay. And what new initiatives do you have?
So for 2025, we have a couple of new initiatives. One is to expand our senior program because obviously that's a growing population. And then the second initiative is to create awareness about mental health and diabetes, because diabetes distress is an actual condition and a lot of people are not aware of it and it's not acknowledged. So we want to spread more education about that.
Okay.
Yeah, and the third thing is also creating some awareness about type 1 diabetes, because that's often missed. We always talk about type 2.
Right.
And so we're trying to create, because there is actually a lot of emphasis on screening type 1 diabetes with the new medications available. There is some, there is some opportunity for prevention.
Okay.
So we want to actually bring that education up front too.
Okay. And how I mean, that's very interesting. And when you talk about the mental health, because we talk a lot about that these days,
Yes.
right? And so that connection of what's happening in your body and how that's impacting your mental. Say a little bit more about that for our viewers.
So there's a condition called diabetes distress, and which means that people who have diabetes, it's a chronic condition, it's a lifelong condition.
Right.
They have to, daily, there's a saying that one diabetes patient has to make over 200 decisions in a day. When we wake up, we say, okay, we're going to have our coffee and we're going to dress up and go to work. A person with diabetes, when they wake up, first thing they think about is, what is my sugar today? When am I going to check it next? When am I going to take my medication? Am I going to go low? Am I going to go high? There's so many things.
Yeah.
So that creates, a lot of distress. It can lead to depression. So it's really important for people with diabetes to get therapy if they need, or have good support system.
Yeah.
And that's what we're trying to build.
Yeah, and I would imagine that particularly once you get into that senior age group,
Yes.
I'm just thinking about my own father who had chronic diabetes. I'm just thinking that would probably really amplify those concerns,
Absolutely.
right? Because
then there are other
issues.
concerns because they worry about falling from hypoglycemia or low
Right.
sugar. There's so many concerns, and seniors are at risk for having more complications.
Yes.
We focus on a lot of education, even with the seniors. We do screenings, but education is really important.
Okay.
To answer the question.
Yeah, no, that's really good to know. How does your organization partner with others?
So one of the key things we want to do is partner and collaborate with other organizations.
Okay.
We work with a lot of other, like for example, senior organizations or organizations for who, like juvenile diabetes organizations, because we include and we participate in their events
Okay.
and help perform screening and education or whatever way we can help. I'm myself part of Naperville Senior Task Force.
Okay.
So I'm taking this diabetes program to the task force and helping them, serve the seniors in Naperville.
Yeah.
Similarly, a bunch of my other board members are part of other organizations where we take our program and help it. And that way we can reach out to a much bigger population.
Yeah, that makes
more
sense.
People. Yeah.
Well, and I think that whole collaboration
that's our goal.
amplifies everything.
So we do an annual walk every year, which is our own event where we perform screening and education, make it a fun family event, including kids. We have activities for seniors. And this year we are actually collaborating with American Diabetes Organization.
Oh, nice.
So they will come with their booth and their, all their education materials and stuff. So we are collaborating with them.
That's great. That's terrific.
Yeah.
Well, that's always
So
nice. I always think that's great when everybody's
Yes.
kind of partnering together, right? How do you feel like, and I think you've sort of touched on some of this, but as we wrap up, how do you feel like your organization is evolving to meet the changing needs? Because it's constant evolution, right?
Yes. So we try to always add new activities or something new every year that we can do. Like this year, we are adding more. We are trying to add type 1 diabetes screening or at least education about it, which will be very new. But this is an evolving topic that has come up. There's much more emphasis. I'm myself part of American Diabetes Association, and there's much more emphasis on this screening because we've been kind of ignoring that.
Okay.
So we're doing that initiative. The other long-term initiative is to try and get like some kind of a mobile clinic so we can reach out to people who cannot reach to us.
Okay.
Reach out to us. So we want to do that and obviously create more emphasis on the diabetes, mental health, diabetes distress part of it.
Okay. Well, you are doing a lot of good work, and this is an area that we know is really important and unfortunately is a growing concern.
Yes.
Thank you for coming by and sharing
Thank you
so much good information.
Thank you so much for the opportunity.
Absolutely. And for more information about Kisat Diabetes Organization, please go and visit their website. We're going to take a quick break, but stay tuned. We're coming right back.
Today's Spotlight is brought to you in part by presenting sponsor, Busey Bank.
This is Busey, where your dreams become moments. With trusted guidance, we'll help you achieve the life you've always envisioned.
We are so thankful for the partnership with NCTV. It allows people all over the world to witness the concert and be a part of that, even if they couldn't do it live. What I love so much is its creative angles. It's trying to find parts of the music and focusing on the people that are playing it. So it's not just sound, it's bringing to life the humans that are making that. So it draws us closer, I think, by connecting people to those experiences on a more personal level, not just a musical level.
Today's Spotlight is brought to you in part by presenting sponsor, Busey Bank.
Welcome back to Spotlight. And joining me now from Martin Avenue Apartments are Mary Curbs and John Gallagher. So nice to have you both here. I can't wait for this conversation because it's always exciting to talk about our friends in the senior community. So I'm going to start with you, Mary. Talk a little bit about your mission and the impact that you're having in the community.
You know, our mission truly is to provide quality, affordable homes for lower income seniors, but in a community that also offers fulfilling lifestyles and reliable resources for them. And, you know, in the last 52 years since we were opened, we've served over 10,000 seniors and their families in the community. And right now we have 200 seniors who enjoy free bus service for shopping, fitness classes, health resources, and just a number of amenities. And there's no one like us in this community or really DuPage County.
Yeah, and I love what you kind of referring to that whole person, right? It's not just about the housing, it's about a lifestyle. I love how you said that.
So true.
Yeah, and also the family. That's a big part for you, isn't it?
Yeah, the whole point is to help them stay independent and allow them to live independently.
Yeah, and Richmond is an important part of that, right? Yeah. John, why do you spend so much time with this organization? You have lots of choices about where you put your time and your energy and your passion. Why Martin Avenue Apartments?
Well, Jane, I have to be honest with you. I drove past Martin Avenue Apartments for 30 years, thinking that it was part of the hospital. It had red brick, so I didn't pay any attention, and I wasn't really into senior living. But Bev Fryer, who I'm sure you're familiar with.
Very familiar.
She nominated me for the board, and I had to research it and find out what it was all about. And I found out what an incredible community gem Martin Avenue Apartments is. The vision and the support of the staff and the board is unbelievable. It's unmatched. And they go out of their way to provide our residents with quality living for seniors.
Yeah, and you just had a pretty big expansion as well, right?
Right, we built a new building annexed to the former building, and the former building has been completely renovated, and we have 190 units and over 200 people.
Yeah, that's incredible. Talk a little bit about some of the initiatives you have for this year, because obviously the building of that expansion was a major project for you. What's up now?
Right. Well, now we're really listening to what else do the residents need for us to truly offer the full package. And what we heard from surveys and town hall meetings that we do is they're having a difficult time managing expenses for dental, hearing, vision, and mental health costs. Many of these costs, expenses are not covered by Medicare and Medicaid. And we began a program this year we're very proud of called Martin Avenue's Road to Health. How do you like that?
I like that title.
Okay. And with that program, we will reimburse our residents for these types of expenses out of pocket up to $1,000 a year. And this program is funded by grants and donations that we receive. And I can't tell you the comments we're getting, the feedback, oh, thank goodness, now I can get the hearing aids I've been saving for. You know, these are all expensive items that the seniors are faced with that maybe the everyday working person has covered by their insurance.
Yeah, well, but I think also too, right, as we get older, you know, sadly, often, you know, it's the hearing, the eyesight, but that can also make us become very isolated, even in a conversation like this, right? If I can't quite hear you, then I'm sort of on the outside of that conversation. So I think those are the things that really so important.
It's critical. And, you know, avoiding dental
not a good
care that's needed, and of course that's when you need it. And the other thing we are doing this year that's new is we did our first senior resource fair. We've brought in resources before, but this time we brought in over 20 various Ride Assist Naperville, all of the services, to our people, to connect them and help them get signed up, whatever they need to do. And so those are a couple of big initiatives that are solving significant issues for our people.
That's great. That's wonderful. And I mean, that's another thing that Bev got started with the Ride Assist Naperville.
So
I
true.
love that concept.
Right.
You know, transportation, again, another big issue for a senior population, right? And quite frankly, would rather not sometimes have them on the road behind the wheel. And who wants to go to a doctor's appointment by themselves? That can be a little bit sad and a little bit intimidating. And if you think you might get some bad news, nice to have somebody with you.
Yeah, so true.
Yeah.
Absolutely.
John, you know, obviously Mary's talked a little bit about some of the different things that you're bringing to your residents, but, you know, from your standpoint, what makes Martin Avenue unique versus other folks in that space? Because obviously there's a growing number of facilities for those who are senior or needing that help. What makes Martin Avenue unique?
Well, Mary alluded to it. We're a not-for-profit, and this allows us to do a lot of things that a typical apartment building can't do. And we have a board that literally is dedicated, and it's by Mary's leadership, that really we go out of our way to enhance the lives of our residents. I tell people that it's the closest thing you can get to assisted living, but it's not assisted living, it's an apartment building.
Yeah.
There's nothing like it in DuPage County, and certainly not in Naperville. We're one of a kind. And we have gone out of our way to make programs available. She mentioned the bus that gives people driving to their supermarket and outings. And we have birthday parties and Christmas parties and all kinds of speakers and things to enhance their lives. And that's really, really important to us. And again, that's something that really made me want to be part of it, because it's not just a place to live. Probably the biggest problem in seniors is isolation. So we put on all these programs and support and resources so that they are drawn out of their homes and intermingle with the people in the building and socialize so that they can have meaningful and independent lives.
Yeah.
And that's really what we're all about.
I love that. Well, and also when you have a volunteer board, because you're a nonprofit, nothing like the heart of a volunteer, right? I mean, those are people that are really wanting to put passion into the purpose.
Yeah,
so that's
there's no other
wonderful.
reason they're there.
Right, absolutely. Not getting a paycheck last time I checked, right?
Yeah.
Not today.
Not today. Love that, love that. Mary, as we wrap up, what excites you for the future?
We've created a model community that works, and we love to bring people in and show them. As you know, we have a 2-year waiting list, and if we opened up a new building tomorrow, there would be another 2-year waiting list. We're ready, and we are looking to build a new location.
That's exciting.
And very exciting. Our entire board is energized. Of course, we need assistance and support from the city, from our community partners. It does take a village to do this type of thing, but we are actively pursuing what is probably our biggest need right now, this growing shortage of affordable housing, and it is not going away.
No.
It is not going away anytime soon. And our vision goes even beyond that. If we could share with other communities our model, because one new location is not going to solve it either.
Right,
right. And other communities can look to do something similar. And we're very proud of what's been created.
It's so good to hear, that you're really trying to tackle that problem. I know that we are not alone in Naperville in that problem. That's something that America in general and likely the world, as we deal with the baby boom and the aging, will continue to struggle with. So we appreciate all the good work you're doing for those in the senior population right here in Naperville.
Thanks so much for having us. We're happy to be here.
Yep. And for more information about Martin Avenue Apartments, please go and visit their website.
Today's Spotlight is brought to you in part by presenting sponsor, Busey Bank.
I'd like to thank all of my guests for joining us on Spotlight, and our friends at Busey Bank for their generous sponsorship of today's show. To learn more about the organizations featured on this episode, please visit our website at nctv17.org. And to stay informed about what's happening in our community, sign up to receive our daily news update and like and follow us on social media. For Spotlight, I'm Jane Wernette. Thank you for watching.